Hi, my name is Heidi Galarza Arudo, and today's topic is Ivacaftor in a G551D homozygote with cystic fibrosis. So definition. Ivacaftor potentiates the open channel probability of the G551D cystic fibrosis transmembrane conductance regulator protein, also called CFTR protein. Let's see this video about Ivacaftor.
In lung airways and passages in other organs, cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface, but fail to open correctly. Kalydeco is designed to keep CFTR protein channels at the cell surface open longer, to improve the transport of salt and water across the cell membrane. Indication and important safety information. Kalydeco is a prescription medicine used for the treatment of cystic fibrosis, or CF, in patients aged 6 years and older who have a certain mutation in their CF gene called the G551D mutation. Kalydeco is not for use in people with CF due to other mutations in the CF gene. It is not effective in CF patients with 2 copies of the F508del mutation in the CF gene. It is not known if Kalydeco is safe and effective in children under 6 years of age. Kalydeco should not be used with certain medicines, including the antibiotics rifampin and rifabutin, seizure medications phenobarbital, carbamazepine, or phenytoin, and the herbal supplement St. John's wort. Kalydeco can cause serious side effects. High liver enzymes in the blood have occurred in patients taking Kalydeco. Regular assessment is recommended. The most common side effects associated with Kalydeco include headache, upper respiratory tract infection or common cold, including sore throat, nasal or sinus congestion, and runny nose, stomach or abdominal pain, diarrhea, rash, nausea, and dizziness. These are not all the possible side effects of Kalydeco. Patients should tell their healthcare providers about any side effect that bothers them or doesn't go away. Please see full prescribing information for Kalydeco.
Application medicine. Ivacaftor is useful in patients with cystic fibrosis who are heterozygous for the G551D mutation.
Hello, my name is Dominic Purcell. You may recognize me from a TV show called Prison Break. I'm here today to discuss a subject that matters a great deal to me, cystic fibrosis. Now, cystic fibrosis has claimed the lives of millions throughout the world, including 3 family members, and now my young cousin Charlie also has it. Now, I'd like to read you something. A new wonder drug is available in the States called Kalydeco. Just take 2 tablets a day, and this would allow Charlie and others with cystic fibrosis a future we all take for granted. Unfortunately, due to the high perceived costs, this medication may struggle to become available to all who need it in the UK and Ireland. We need your help. Please back this campaign to get this drug to Charlie and everyone else with cystic fibrosis. Go to Facebook, Quest, for Kalydeco. Like the page to show your support and see what everyone can do to help. Thank you.
Pros and cons. Continued clinical improvements in lung function, weight, and walk distance were reported as positive effects. Interview with Stefan. PhD.
Kaleido represents an excellent example of the future of personalized medicine. Having the right medicine for the right patient based on understanding of the mechanism of disease. And in turn, having a diagnostic test, a genetic test, to select the right patient to receive that particular medicine. It's really a remarkable story. Cystic fibrosis is a serious genetic disease, and Kaleido is the first medicine targeted at the cause of the illness, not just dealing with the symptoms or complications. It's also a part of a revolution about how we will treat patients in the future, using increasingly targeted, personalized treatment. Patients with cystic fibrosis have a mutation or an abnormality in a gene that codes for the CFTR, a membrane protein. Abnormal function of this protein leads to the symptoms of cystic fibrosis, including thick mucus secretions in the lung and in the digestive system. There are many different mutations that lead to cystic fibrosis. Each patient has one specific variant or abnormality in that gene. And Kaleido is targeted against one specific abnormal protein product of one specific abnormal gene. Kaleido will improve the function of that protein, and in clinical studies it was shown to improve lung function and beneficial weight gain. There are approximately 30,000 patients with cystic fibrosis in the United States, and approximately 4% of those have the specific variant that Kaleido will help. In other words, about 1,200 patients.
So let's continue. On the other hand, little is known about the response to Ivacaftor in persons with a forced expiratory volume in 1 second of less than 30% of predicted value. So, but what is cystic fibrosis? Let's know a little bit more with this introductory video.
The University of Tennessee Medical Center is our region's only academic healing education. Our goal is to, in these healthcare decisions,
Cystic fibrosis is an inherited disease that can affect many different organ systems, including the lungs, the digestive tract, the pancreas, and eventually even causing diabetes. It can lead to cough, recurrent lung infections, digestive issues, as well as many other problems. Cystic fibrosis tends to affect Caucasians more than other races, but it can affect African Americans, Hispanics, and Asians as well. There is currently no cure for cystic fibrosis, but there are many treatments. Patients will need to do a variety of inhaled medications as well as treatments to help remove mucus from the lungs, and frequently they will need recurrent rounds of antibiotics. The survival of cystic fibrosis patients has improved dramatically over the last few decades. 20 years or so ago, patients would not live into their teenage years, and now patients will live up into their 30s and 40s, and we even have some patients up into their 50s now. To me, that is one of the most exciting things about cystic fibrosis. We have new treatments coming along frequently, things to improve sputum clearance, We also have new medications that go directly to the genetic cause of cystic fibrosis, and we hope will markedly improve the survival of cystic fibrosis patients even more.
We hope you'll join us soon for another medical moment. Visit.
The common symptoms are very salty intestine skin, persistent coughing, or at times with phlegm, frequent lung infections such as pneumonia or bronchitis, wheezing, and poor growth or poor weight gain in spite of a good appetite. This is a real testimony. I think it's a good idea to see it. Oh, I'm sorry. Okay.
My name is Taylor Bush. I'm 15 years old and I have cystic fibrosis. I was diagnosed at 11 months old.
She was sick all the time. It just seemed like all she did was cry, and I took her to pediatrician after pediatrician, and they all told me it was colic. And then finally one pediatrician suggested that I take her to Dayton Children's and have some tests run. And they ran several tests, and she came back positive for cystic fibrosis.
Patients with cystic fibrosis have thicker than normal mucus in their chest, so it's like having a bad cold every day of your life. As is typical of most teenagers with cystic fibrosis, Taylor is having some ups and downs. Overall, she has stayed fairly stable, but over the last 6 years, her lung function has probably dropped by about 5 or 6%, or about 1% a year.
I'm going to say I take around 25 to 30 pills every day. Some of them are antibiotics, enzymes that help break down the nutrients in the food to help me gain weight and stay healthy. And then I have to take a treatment, which is a vest that I wear that blows up with air and shakes me to help shake the mucus off the walls of my lungs and help me cough it up. But while I'm doing that, I also have to take inhaled medicine to help break up the mucus.
Now you have a 15-year-old that wants to be a 15-year-old. I mean, that's just wants to be a normal kid. It's nice to go to a place like Dayton Children's where you have that understanding, and they're very compassionate about that, and it helps ease some of that pain.
So you're here for 2 visits today, right?
Yep.
We appreciate Dayton Children's so much. I mean, I'm not sure Taylor would be here if Dayton Children's wasn't here. I mean, they're the closest CF clinic. If we'd have to go elsewhere, and I'm not sure that they'd take as good care of her as Dayton Children's does.
I'm completely in love with the staff at Children's. They take care of me, they entertain me, they help me get up when I'm down and stuff like that. So I just really, really like the staff.
She has her favorite nurses. There's some that, she actually requests.
Yeah, that would be Nate the Ninja Nurse.
That's true.
He's my favorite nurse because he's just like a lot of fun, and we have this thing where we always shoot rubber bands at each other and like empty syringes of water, and like he's just really funny, and he's my favorite nurse because he always keeps me laughing and he keeps me like entertained.
Yeah, with Taylor being here for so long, it's easy to get down and disappointed about being in the hospital, away from your friends, away from your family, when you're in here for a couple weeks at a time. But through the rubber band fights and things, it kind of makes things seem like a little bit more like home for her maybe, and takes her mind off of what she's missing out on while she's here at the hospital. All right, you won this time.
Yeah, I did.
The next time.
No, next time.
All right.
Taylor's a very pleasant young lady with cystic fibrosis who really doesn't let her disease get in the way of leading a normal life. She takes the hour and a half a day to do her care on a regular basis, and that's a major burden for a teenager.
What makes her so special in a variety of different areas is her ability to go through what she goes through and accept it. I mean, she accepts it very openly and graciously.
As a teenager with CF, there aren't a lot of major disadvantages that I've noticed, so I don't like for people to like sympathize and think that I'm gonna like go off and be really sick and feel bad for me. I just want to be treated like a regular teenager.
Very good video. So the treatment is not only the Ivacaftor, sorry. It also include airway clearance, take inhaled medicines, and pancreatic enzyme supplement capsules. So thank you very much for watching and see you next time.